first sterile product that we'll discuss today is Vaxcel Mometasone 0.05% weight over weight nasal spray. This medication is used to treat symptoms of allergic rhinitis such as sneezing, runny or blocked nose, and nasal itching, and other nasal inflammatory conditions. Next, we're having Vaxcel Azithromycin 500mg IV for infusion. This is a macrolide antibiotic intended for intravenous use, primarily for adults requiring initial IV therapy.
Now, we will cover the active ingredients, strength, and concentration. First, let's look at the Mometasone nasal spray. The active ingredient is Mometasone furoate, and it is come in a strength of 50 micrograms per spray. Meanwhile, for Azithromycin IV infusion, the active ingredient is Azithromycin with a strength of 500 mg. After reconstitution and dilution, its concentration is typically around 1 mg per ml to 2 mg per ml, depending on the final volume.
There are some therapeutic indications for Vaxcel Mometasone 0.05% weight by weight nasal spray. Firstly, it is indicated to treat allergic rhinitis for adults and children aged 3 years and above, simply to treat seasonal and perennial rhinitis, and is recommended to be used 2 to 4 weeks before allergic season start. Secondly, the product also can be used to treat acute rhinosinusitis in patients aged 12 years and above, and can be used only if there are no signs of severe bacterial infection. Thirdly, the product also indicated to treat nasal polyps in patients aged 18 years and above. It helps to reduce size and symptoms by shrinking the polyps and relieves nasal blockage. Vaxcel Azithromycin 500mg IV for infusion also has some therapeutic indications, which is to treat community-acquired pneumonia caused by bacteria Legionella pneumophila and pelvic inflammatory disease caused by bacteria such as Chlamydia trachomatis. It is to be used for patients who need initial IV treatment to treat their symptoms.
For instruction of use of Vaxcel Mometasone nasal spray is wash hand thoroughly with the soap and water. After that, remove the cap and hold the inhaler upright. First, shake the inhaler 3 to 5 times in the up-down motion. After that, prime a dose for new inhaler, or if the inhaler is unused for 1 week or more. Breathe out slowly through your mouth. Hold your inhale and breathe in. Press down the inhaler to release the medication. Remove the inhaler from your mouth and hold breath 4 to 10 seconds, then breathe out slowly. Rinse your mouth thoroughly with water and spit out, do not swallow. Next, how to use the Azithromycin for IV for infusion. First, prepare the equipment such as IV fluid, IV set, glove and alcohol swab. First, insert IV line. Choose the vein on the clean skin and insert the catheter. After that, secure with a plaster. Set up IV fluid. Connect IV set to fluid to fill drip chamber. Now we start the infusion. Connect the patient and adjust flow rate of the order and monitor the patient, which is check IV site, patient condition and fluid level in patient. Lastly, stop the infusion by clamp the tube and remove the catheter. Lastly, press it to cover the site.
Let's move on to precaution and contraindication of Mometasone nasal spray. For precaution, firstly, use with caution in recent nasal surgery or trauma. This is because the nasal mucosa might be compromised and the corticosteroid can potentially impact healing or most sign of infection in a vulnerable area. Secondly, monitor growth in children with long-term use. Long-term use of corticosteroid, even topically, can potentially lead to systemic absorption and affect growth in children. This precaution is to mitigate potential systemic corticosteroid effects. Thirdly, monitor for nasal septum, perforation or ocular issues with prolonged use. For contraindication, first, should not be used in patients with hypersensitivity or allergy to Mometasone furoate or any component in the product. This is a standard contraindication for any medication. An allergic reaction can range from mild to severe and is a direct immune response to the drug. Secondly, contraindicated in patients with untreated localized infection involving nasal mucosa, for example tuberculosis or fungal infection, as corticosteroid can suppress the immune system. Using them in the presence of an untreated infection could allow the infection to worsen or spread. It's important to treat the infection first. Last but not least, not suitable for immediate use after nasal surgery or injury. Similar to the recent nasal surgery or trauma precaution, immediate use could interfere with the healing process or most sign of complication with the acute post-operative or post-injury phase. Now, let's move to the precautions and contraindication for Azithromycin. It is largely due to its mechanism of action as a macrolide antibiotics, its metabolism and potential interaction with other body system or medication. Firstly, hypersensitivity. It is contraindicated in patients with known allergy to azithromycin, erythromycin, or other macrolide antibiotics. This is a fundamental contraindication for any drug. An allergic reaction to one macrolide antibiotic suggests a potential cross-reactivity to other in the same class due to similar chemical structure. Next, cardiac risk. It is used cautiously in patients with prolonged QT interval or electrolyte imbalance, such as hypokalemia and hypomagnesemia, due to the risk of arrhythmias. Why? Because azithromycin is known to prolong the QT interval on an electrocardiogram, which can lead to a dangerous heart rhythm called prostate points, especially in individuals already predisposed by a prolonged QT interval or electrolyte imbalance.
For packaging and storage of Vaxcel Azithromycin 500 mg IV infusion, it is packed in a vial with total of 10 vials per box. It should be storage below 30 degrees Celsius, protected from light, and keep out of reach of children. Then, Axcel Mometasone 0.05% with overweight nasal spray is available in plastic bottle of 60 ml dose and 140 ml dose. This medication also required to be stored below 30 degrees Celsius and should be protected from light. Axcel Mometasone shouldn't be freeze and patients should shake well before use this spray.